that answering those? Karen, did you want to come in?
Just to say, I think I believe that one of the hesitancies is around fertility and people who are going through IVF.
Yep. Tracy, did you want to come in there?
So I think that there's been, I mean, this is not a new debate. This is the debate that we had quite a lot with a lot of the care home staff, and I did quite a lot of Q&As about fertility. I mean, there's no reason to think it has any effect on fertility. And the advice we're giving now is that if you're pregnant, you need to be vaccinated. So therefore, in actual fact, if you're undergoing IVF, the best reason to be vaccinated is to protect the baby, because the most likely, the significant number of people we've had in with preterm births and babies' deaths have been those that have been pregnant. So there's no evidence it affects fertility. There was a lot of debate at the beginning about that, and one of the questions that we got back was why is that for pregnant people then exempt? We think that's more to do with legislative law about pregnancy and that you can't lose your job when you're pregnant. So we think that that's not been changed rather than the vaccination part of it. I think that's what we thought at the time, Louise, because that obviously is an exemption as to why you don't need to be vaccinated, but that's all to do with legislation about pregnancy and not being allowed to lose your job because you're pregnant. Therefore, you can't make somebody have something that they don't want to do. So that's a slightly converse way. I mean, I think discussions about fertility and talking to those patients, I mean, pregnancy is the one area that we are not pushing vaccinations, but we're trying to have one-to-one conversations with all people who are either thinking about becoming pregnant or are pregnant to try and encourage them to be vaccinated, because we've had we've had a number of deaths at Bradford of both babies and mums, and that's nationally as well. So there's no reason to think a vaccine has any effect on fertility. One of the reasons that was cited was that people sometimes bleed, but that's because you get a response, and those are also in the womb as well, so you could get that, and that's why some of the menstrual cycle issues had occurred. Some of the discussions in fertility were very, very early on, and currently there is no evidence to suggest it has any effect on fertility at all. And the best thing they can do is to be vaccinated early so that they are vaccinated when they become pregnant, to protect themselves and the baby.
Picking back up on the fertility points, if the Royal College of Obstetricians and Gynecologists have got some really good information sources. If you just Google RCOG, Royal College of Obstetricians and Gynecologists, and COVID vaccine, they have got pages of information on there talking about fertility, and that there's no plausible mechanism by which the COVID vaccines can cause fertility. There is some information on there. If somebody is going through IVF at this moment in time, they do talk about kind of the timings of IVF with regards to actually having the dose, and that is also the case with some other doses of immunocompromised medication that some people take. So that's more to do with the timing as opposed to not having it. And as Tracy says, we've unfortunately seen some really sad things with people who have been pregnant. And if we think of, say, a particular medical treatment called ECMO, which is where people, so you've got critical care beds, which is kind of where most people think of the sickest people. Well, if you're too sick for critical care and you go on to what's called an ECMO machine, this is a machine which helps to transfer blood directly into a person, oxygen across in a person, or which is only a few of those in the country. So if you're really sick of critical care, you go to have ECMO. If you look at pre-COVID, the number of pregnancy patients on ECMO was 20%, where actually the number of patients who are pregnant on ECMO at the moment is 80%. So a large number of pregnant people are having to go through this treatment, which is unfortunately very, very sad. And we highly recommend that people do get vaccinated, ideally before pregnancy, but during pregnancy to help protect them, particularly in that last trimester, which is where we're seeing a number of poor outcomes through people who are pregnant.
Can I just ask then, is it best to come through the Airedale route if a member of staff is concerned about IVF and timings, or is it best to go directly through their own consultant?
So they could do either way. I think that because they'll be having regular consultant appointments, it would probably best to get their advice as to the timings of it. There is some information on there. If there's someone there, if they can't get access to the consultant, we can always contact one of our obstetricians, either at Airedale or at Bradford, to get that advice on this per patient basis. The number of patients won't be huge, but we'll be able to find that information, and it does talk about the timings in there. It's just because of the they just want to split the kind of the egg implants with that, so they might just say wait 2 weeks, for example, might be there. I'm guesstimating here, but yeah, either through the consultant or come through to us, and we can provide that advice or look into it in a bit more detail on that.
Brilliant, thank you.